Hello friends, let us now learn some important points about the placenta. Placenta in humans is, that is, human placenta is discoidal, that is, it is disc-like shape. It is deciduate. Human placenta is discoidal, deciduate, that is, shed off after delivery, or there is hemochoroidal. What is hemochoroidal? That is, it lies in contact with maternal blood directly. Okay, so these are the main three important points about human placenta. If you will see the one-liners, the weight of placenta at term. The weight of placenta at term is almost 500 grams. Then if you were asked what is the ratio of weight of placenta is to fetus, ratio of weight of placenta is to fetus is 1:6. Then if you were asked what is the weight of placenta, weight of placenta is equal to weight of fetus. Weight of placenta is equal to weight of fetus at 17 weeks of pregnancy. Okay, now what are the named cells? If you see the named cells in placenta, the named cells in placenta include, these are, one, we have half-Bohr cells. Half-Bohr cells are the named cells in placenta. Then we have PEG cells. PEG cells are the named cells in fallopian tube. Okay, then the named cells in, what are the named cells? Langerhans cells are named cells in cytotrophoblast. Then Nita-Busch layer. Nita-Busch layer is, what is Nita-Busch layer? It is fibrinoid degeneration which is seen between chorion and decidua is called as Nita-Busch layer. Okay, now this half-Bohr cells is infected by Zika virus. Zika virus will infect the half-Bohr cells. Then if you see formation of villi, primary villi is only a trophoblastic shell which is formed at formation at day 12 of fertilization. Then secondary villi, which is nothing but mesodermal core. It is formed at day 12 to day 16. Then we have tertiary villi, which is vascular, and it forms at day 17. So if you were asked what is the layers seen in the placental membrane, layers in placental membrane or placental barrier, layers in placental membrane and placental barrier are syncytiotrophoblastic, followed by we have cytotrophoblast, followed by we have extra embryonic mesoderm, then we have fetal capillary endothelium. Okay, so these are the layers in the placental membrane or barrier. Next, now let us now learn the differences between uteroplacental circulation, which occurs in villi, and fetoplacental circulation. Okay, this also occurs in villi. Okay, uteroplacental circulation occurs in intervillous phase. Uteroplacental circulation, it is formed in day 15. Number of spiral arteries opening in intervillar space is equal to 120. If you see the oxygen saturation in intervillar space is around 65 to 75%, and if you see the partial pressure in intervillar space, it is 35 to 45 millimeters of Hg. And then if you see uteroplacental blood flow at term, uteroplacental blood flow at term is equal to 500 to 750 milliliters per minute. Then if you were asked what is the uterine blood flow at term, uterine blood flow at term is equal to 750 milliliters per minute. Okay, uteroplacental circulation and uterine blood flow. Now, if you see fetoplacental villi or fetoplacental circulation, the fetoplacental circulation which occurs in villi, this is established at day 17. What is fetoplacental circulation at term? At term, fetoplacental circulation is around 400 ml per minute. What is fetal blood flow at term? Fetal blood flow at term is 125 ml per minute, ml per kg. Then if you were asked what is the rate of delivery of oxygen to fetus, it is around 8 ml per kg per minute. Okay, so this is about uteroplacental and fetoplacental circulation. Thank you for watching.